Hello, I'm here with my aunt, Cindy, and she is the director of operations at a home health agency. So I have a couple questions for you to answer. Could you describe one of your typical days at work for me?
Yes, we go in the morning at 8 o'clock. We check all of the answering services to see if anyone has called us overnight and need any services. From there, we pretty much schedule visits to where the nurses go out and see their patients. And if any doctors call in with new orders, we process those orders. And we typically do billing insurance companies and different things like that.
All right. What parts of your job do you find most challenging?
Getting doctors to sign orders. For instance, a doctor can place a patient on home health services, but they don't sign the orders in time for billing purposes, so we have to stay on top of doctors to make sure that we get those orders back in an orderly fashion.
What do you find most enjoyable?
Helping patients who are not able to go out to seek medical services, instead we come to their homes.
How many hours do you work a week?
40.
Which seasons of the year are toughest in your profession?
Summer, because sometimes we work with a lot of older patients, so they don't have AC systems in their homes or different things like that. And so when we go into these patients' homes and we see their living conditions, they're the worst time for us.
Yeah. So these questions are more about the career as a whole. So in this field, is there room for someone like me to grow?
Of course, there's always openings in home health, any medical field that you choose to go into.
Okay. Are too many or too few people entering this profession?
As far as nurses, I would say that there's always a shortage of nurses. As far as physical therapists, there's a shortage of physical therapists, there's a shortage of occupational therapists, and there's a shortage of speech therapists. So the answer to your question would be yes.
Okay. What sorts of changes are occurring in the occupation?
Rumors are that in order to become a nurse, they will no longer be accepting 2-year courses of LVNs in the future.
Yeah.
Also, you will not be able to go to school to become a PTA. For example, for 2-year programs, you would have to go to school for 4 years to be a PTA. So there's some rumors of different things that are changing as far as changes are concerned.
Are there opportunities for self-employment in your field?
Yes, you can be a PT physical therapist, you can be an occupational therapist, or you can be a speech therapist, and you can have your own company. So there's always room for self-employment as long as you start a company or you have a license on your own that you can be contracted in. Yes.
So what is the advancement potential in this field?
There's always room to grow. There's always room to make more money. Anything that you do in the medical field, there's always potential to make money.
How did you get your job?
I graduated with a bachelor's degree in psychology, and I didn't know what I wanted to do from there, so I applied to different positions. I started off as a marketer, and when their director of operations left the position, they interviewed me and I took it.
How would you suggest someone gain paid or unpaid experience in this field?
Unpaid experiences is always a potential because we always reach out to schools looking for different people that we can have to come in to get experience. If you just graduated from a school, you can always apply, and if you're, for instance, a nurse, it doesn't matter. There's always someone there to train you. If you're a nurse's aide, there's a high demand for nurse's aid, so there's always a room to grow for nurse's aid as well. As long as you're willing to put in the time, the hours, and the dedication to the job, and willing to travel, you're always willing and able to get a job in home health.
How did your college experience prepare you for this job?
anytime you have a bachelor's degree, I think that you're more profitable to a company. However, if you have some experience with home health, or if you have experience with any type of medical field, it's an advantage if you're trying to go into the home health or hospice or any kind of agency like that.
Can you recommend any courses I should take before proceeding further?
I would think that you should probably take medical, not necessarily coding and billing, but what is it called? Like when you
Terminology?
medical terminology. I think that every person should take medical terminology so that way that you would know the different, different areas that you're billing in, or the different things that are coming about with patients, so that way you have a knowledge of it on your time.
Okay. So I have to show you my resume. This is a online version of it. You can look at it. My teacher would like to see your reaction.
So seeking a university that is equally invested in my academic wellness and that will help me to obtain the career goals that I can achieve, turn to college and career high school, hobby for football, achievement cap and on Wednesday at Carolina University football defense back from JV basketball, extracurricular group of students for the SAT, so it was a great weather to 11-year-old boarding school or without a positive male role model, for 5 community service hours, recorded in my high school career. Received a 17-10 on SAT. Impressive.
Thank you. Well, thank you, Ms. Pamela. Appreciate it.